Hi everyone, my name is Luis Alcaraz. Please remember that this video is only intended as a source of learning and information. Please always contact your audiologist for more questions and further treatment. Hey guys, my name is Luis Alcaraz, and please remember that I always do the videos to make you a better informed consumer. And today in our audiology series, we're going to be talking about swimmer's ear, or also known as otitis externa, or an outer ear infection, also known as acute otitis externa or swimmer's ear, as I mentioned previously. Coming up, you guys. All right, so what is swimmer's ear? Swimmer's ear is an outer ear infection due to a fungal infection or especially water exposure. That is really the culprit or why you can get swimmer's ear. People who surf a lot, who do water sports or swim a lot, even a very short exposure in the water, even just by simply limiting, even by simply a small exposure in the water, it's that water getting trapped in that tunnel in the ear that can cause swimmer's ear. Even a very small water exposure can cause a swimmer's ear. Now, if you get swimmer's ear one time, you're good to go. But if you're constantly, repeatedly getting swimmer's ear, you're probably going to have to talk to your doctor. And we're going to be talking about how to protect your ears in a little bit. But first of all, what are the symptoms of swimmer's ear? Well, the symptoms really are a very intense pain in the ear, especially in the outer ear. When you wiggle your earlobe or your pinna, you say like, ow, ow. That is the main symptom. It's very, pain that can be severe. Also, nausea or, it's really just pain and discharge from the ear. It's, from the otitis externa, the main symptoms are pain that can be severe, discharge or fluid or pus from the ear, and even nausea, or even a slight fever is possible. And believe it or not, swimmer's ear can actually be even more painful than otitis media, believe it or not. Other symptoms, when it gets severe enough, it can include a slight fever, or when it's painful to chew, when it gets severe enough, when it can go to the side of the face. Now, how do you treat swimmer's ear? It really just depends on the severity, but typically a mild case of this infection would include, it will just heal on its own. Because sometimes swimmer's ear will heal in a couple weeks. But if you have a moderate case of swimmer's ear, when you're having severe pain or even a discharge from the ear, you're probably going to need some ear drops that your doctor, some antibiotics, ear drops that your doctor can prescribe to you. However, sometimes when it gets severe enough, the doctor may have to do the eardrops in her office or his office. In that case, to help the ears stay open from getting shut. If it gets severe enough, the doctor, he or she will have to do it in her office to do those eardrops. But typically, 7 to 10 days of eardrops for swimmer's ear, 2 to 3 times a day, will typically, get rid of the infection. However, some bottles say to finish the bottle completely in order for the infection to completely clear out. Now, what do you do if you're constantly, repeatedly getting swimmer's ear? Because it can be very painful. Now, swimmer's ear, if you're constantly, if you got it once just by surfing or swimming a lot, you're probably good to go. But if you're constantly, repeatedly getting it because of water exposure, I would recommend wearing some earplugs when you go swimming, or maybe even limiting the water completely if you're constantly getting a repeated swimmer's ear infection. Other causes that can cause swimmer's ear are too little earwax or eczema, people that don't produce enough earwax. As we were talking with that previous video, earwax is a protective barrier. Earwax is a protective barrier that can protect your ears from fungus, ear infections, and that kind of stuff. If you are having an episode of swimmer's ear, please don't hesitate to contact your audiologist for further treatment, guys, and they will help you out. All right, guys, that's it for this video. Thank you.